Hello! Our last video was on how to do a sample history. Today, we are going to talk about DOTS. And I'm not talking about the chewy candy. I'm talking about the acronym DOTS. Deformities, open wounds, tenderness, and swelling. So, when you are treating a trauma patient, you use DOTS in your treatment. Okay? So you're looking for deformities. You're going to check against the opposite side, right? If you cut the human being in half, one side of the body looks almost identical to the other side of the body. There's slight differences, but we're all put together the same way. All right? So if you have a deformity on one side, you compare it to the other side. Make sure that it's, within what normal looks like. And then you treat accordingly. Figure out what the deformity is, right? Is it a broken bone? Is it a broken joint, right? And then you're going to immobilize that, all right? If it's a broken bone, you're going to splint it. If it's an open fracture, you're going to treat that for blood loss, right? So the next part happens to be open wounds, okay? So before you start doing this assessment, you're going to put gloves on your hands, right? Because you're going to touch somebody else. And if it's wet and it doesn't belong to you, you don't want it on your person, okay? So put gloves on your hands and you're going to check for open wounds. Using your gloved hands, right? You're going to sweep under the patient, hands together. Then you're going to bring them out and you're going to look, is there blood on my hands? And then you're going to move down and you're going to do it again. Is there blood on my hands? This is easier if the patient is alert and mobile, right? But if you have an unresponsive patient, this is definitely a tool that you're going to have to use because, yeah, they can't tell you, right? Gunshot wounds usually have an entrance and an exit hole. So when you're doing this sweeping method, you're finding that exit hole. Okay. Tenderness works best on a conscious patient, but even unconscious patients will respond to tenderness with pain most oftentimes, not always. Okay. So you're going to palpate and check for tenderness on joints and muscles and the chest and abdomen. Okay. And you're going to check for tenderness. And then we're going to look for swelling. Okay, you can do all of these all at once. You don't have to do them one at a time. Make the best use of your time, right? As you're sweeping, checking for open wounds, you should be looking for deformities. And you could also be looking for tenderness as you're sliding your hands on the bottom side of the body. All right? This is for your educational purposes. Go get training. Do not treat above your scope of care. If you are a civilian, the Good Samaritan laws only protect you for things that a normal, rational person would do, okay? You cannot put holes in people to save people unless you're trained to do so, okay? That leads to lawsuits. So, treat within your scope of care. Go get trained so that you have a scope, right? Do you have training? Now you know how to do it. I appreciate your time. Go forth and do wonderful things for the creator of the universe. He loves you. He wants you to love your neighbor.